Welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy talking about a bunch of topics, having a lot of fun. All right, we talked about breast lift, so let's talk about breast reductions.
Sure.
Now,
They're related.
They are related. That is so true. But here's my question. All right, so breast reductions, a lot of women like a nice sized breast, so they're like, you know, maybe I should live with the breast this size, even though it's painful and problematic. I think a lot of women don't want to get rid of those breasts at any, you know, case.
It's variable. It depends on how much grief they're causing the breast.
Right.
You know, if you're having a lot of neck pain, back pain, it really helps with that.
I think a lot of women just live with that stuff, thinking that they have to, but that's not the case.
No, it's not the case. And a lot of the folks that I take care of, especially if they're coming in a little bit later in life, after we do the surgery, usually the first thing they say is, why did I wait so long?
Relief, exactly.
Because it does get rid of suffering.
Yeah, absolutely. And so how do you do a breast reduction?
So breast reduction is very similar to a lift. So we're essentially doing a breast lift and reducing breast tissue.
Okay.
So I worry about the volume, want to get to the right size.
Okay.
Worry about the shape, and that's what the lift takes care of. And the lift also tightens the breast, which keeps it from moving as much, which I think also helps with the pain because we don't have the torque of the weight, you know, spinning and twisting the neck, twisting the back.
Does it reduce, you know, how much? I mean, can a woman choose how much?
It's really variable, yeah. We can reduce a little or a lot. I always say that grass is always greener on the other side of the hill, and the C cup is the hill.
Yes.
So the women who are much larger are usually wanting to go to a B. Or smaller. The women who are smaller usually want to go to a D.
Okay.
But yeah, they've had it. They're tired of it. They want to go to something different at this time.
Absolutely.
And it does really help. And what's amazing to me is sometimes the breast reduction, especially for the very large breasts, in order to get everything back together, make it pretty, and put it together very carefully, it can take 4 or 5 hours.
Really?
After 4 or 5 hours of surgery, I had patients waking up going, I feel better.
Oh, really?
And it's not what I expect after you know, doing surgery for 4 or 5 hours.
Oh, geez.
And it's just that dramatic. Their neck feels better right away.
All the weight
their
taken
back
off.
feels better right away.
All right, let's take a look at before and after pictures, and we'll talk about scars and that too. First one? Oh, wow.
So again, similar to the scars we saw with the lift. In this case, there's one around the areola, which is the colored skin around the nipple. There's one that runs down to the bottom, and then one that runs right along the bottom. And what I try and do is keep that lower incision in the fold. So we don't want to see it in the middle for sure, because that may be seen in clothing.
Right.
And off to the side, if we go farther, it tends to give a redder, more angry scar. So we just want to try and limit that length.
Do you do implants with reductions, or
very rare?
Oh, really? Very rare.
It's kind of like, you know, push me, pull you. You're trying to make it smaller and add an implant. But again, it's for shape. So if someone has all their breast tissue, there's absolutely nothing above. A small implant sometimes will help it. Very unusual.
Next pick.
So same idea here. I've got the incision along the bottom and running up to the nipple and around the areola. So everything gets lifted up.
Very good.
A little less reduction in this case than the previous one.
And so
and I find for younger women, we tend not to reduce as much.
Oh, really?
Go more to a C or something like that. I can see a lot of ptosis. So her nipples were about at the level of her belly button.
Okay. Yeah.
So what we've done is lift everything up. Again, the nipple is kept on the breast tissue that's there. That breast tissue is moved up. You can see the vertical scar there. She has a little pigmentation, and the one along the bottom, we call it the horizontal scar. If I were to do this today, I would probably try and do it without the vertical scar.
Really? Can you do it without the vertical scar?
In this case, I could, because there's plenty of skin on the upper part of the chest to put the nipple under and not have to have that vertical scar. Vertical scar does let me pull things together side to side. In this case, no vertical scar.
Wow.
So what I've done is move everything up.
That's a drastic change there, though.
Big reduction.
That looks really good.
Big reduction, but nice shape, good symmetry. Still has curviness.
Yeah, very nice.
Made things flat. It still has breasts. There are still breasts there.
There are still breasts there. Now, when you do the nipple, do you have to take the nipple completely off?
No, in these cases, I'm leaving it attached to the breast tissue that's under it and moving the breast tissue up. The case when we take them off is either when we're trying to make things expedient. So if I have an older patient with some medical problems, sometimes we will do it as a graft. And for men, when we're trying to make everything flat.
So sensation is all still there after surgery?
So sensation should be intact.
Good.
Again, her nipple has been lifted up with the breast tissue, and the extra skin is taken away.
Very good.
And
quite a dramatic difference.
And she doesn't look really big, but she had a lot of symptoms. I mean, her neck and back were really bothering her. And you can see how she's kind of throwing her shoulders back trying to support the weight. Afterwards, her shoulders are actually forward.
That can cause a lot of problems.
Yes.
So that's huge if you're considering breast reduction.
Very
Next
helpful.
pick.
And same idea here. Again, a little more asymmetry in terms of where the nipples were before. You know, since we're kind of picking where they go, we can even that out quite well and help make things even.
Sounds good. Thank you. Great pictures. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, either drmealy.com or sanfranciscobreast.com. We'll be right back on Body Beautiful.